the health risks that are involved, I have no problem with doing a what you call a breast lift or a breast reduction on a patient. It's all about, for me, it's not about the age. For me, it's about how healthy you are for surgery, and the reasons behind it as well. Because some people will be like, I want to look like Kim Kardashian, and I was like, maybe I can't make you look like Kim Kardashian. So most people, I'm always like, maybe go somewhere else.
So when you actually come and say, I want to look like you,
say a lot of strange things. And people can be difficult. So sometimes you want to pick out that person who's going to give you problems way at the beginning, and you're like, maybe no, let's not do this. So yeah, so for me, I'm not speaking for every surgeon, but for me, I always want to listen to someone's story and always think, is this necessary? Because yes, people will always be like, breast lift is not necessary. But I always think there is a reason, right? If I had droopy boobs or big boobs, I would want them reduced. But the story is always different. You always find someone who is not factual, who wants things that are out of this world. Then you have to walk away from exactly. So you have to walk away from those people very quickly. But people who want things that are within reason, then I am very happy with doing those cases. Yeah.
Hi everyone, welcome to another episode of Moments with Nyengeterai. And today I am so excited about the conversation that we're going to have. A lot of the women have been asking me to bring someone who can just clarify questions that they have about these things that are happening out there. And today I just have the right person, and I've curated all the questions that you sent me for her to answer. So today I have Dr. Tinga in the house. Dr. Tinga, welcome.
Thank you. Thank you so much for having me.
So before we go anyway, can you just tell our viewers who you are, what you do, a brief introduction about yourself so they know?
Okay. So my name is Dr. Tinga Nyoni. As you've just said, I am a plastic surgeon. I am currently practicing in Zimbabwe, in Harare. So I am both in government practice and private practice. And I practice the full spectrum of plastic surgery, to the people who are in accidents, to the people who want a BBL. So yeah, that's what I do. And I'm just a normal girl after the scrubs are off.
Oh, okay. Wow. Yeah, you heard. She's a plastic surgeon. So this is the reason why we brought Dr. Tinga, because a lot of questions have been coming in. But before we go there, let's just start from your childhood. If you look back at your childhood, what made you, or what influenced you to become a plastic surgeon?
So I always laugh and say my mom is really good at brainwashing, because I feel like my mom has always wanted a doctor as a child. And I always joke with her and say, I feel you were whispering this from the time I was a child. Because I've never wanted to be anything else. From the time I was 2 years old, like my relatives will tell you, I always said I was going to be a doctor. Hi, my name is Tinga. I'm going to be a doctor. And then, so initially I wanted to be a gynecologist, and I used to call it gambacologist. So today people in my family will be like, Tinga the gambacologist, because I asked my mom, I was like, which doctor helps women? And then she was like, it's called a gynecologist. I was like, okay, gambacologist. So that's it. So it has always been medicine. I've never wanted to be anything else. And luckily enough, my grades were good enough for me to get into med school. Then when I got into med school, I then realized it was always going to be surgery, because in surgery, you get to actually fix the problem right there and there. Whereas in other specialties, you have to wait for medication to do its work and all that. In surgery, I know it sounds very brute, but we kind of get in there and cut the problem. We remove the problem. We're on like right there and there problem solvers. And that's just generally my personality. So it was always going to be surgery. And then when I was going through my internship, and then I started thinking, what surgery do I want to do? Initially, I was thinking cardiothoracic surgeon, that's the heart and lungs. But then I felt that there's a lot of very sick people in there and all that. So I thought maybe my heart would not be able to take it. So, and then I stumbled upon plastic surgery. And it was very fascinating to me, because you kind of get to be an artist as well as a surgeon. And I kind of like that aspect of things. And it was one of those things where, even till now, there are not a lot of plastic surgeons in Zimbabwe. So I was like, yes, there's a need. And then I realized that there's a lot of like subset of people that people are like, no, 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 you're fine because you're not dying. So you're fine. And then I was like, no, but these people still have deformities that they got from burns, deformities from accidents. This is a whole subset of people that need help. So that's what attracted me to plastic surgery. I get to be an artist. I get to help people who are not getting help before. And so it was just, and then from then on, I've never looked back, and I still do not regret my decision.
Wow. Of course, for me, just the fact that from when you were young, you wanted to be a doctor. I mean, I changed. I remember when I was young, I wanted to be an air hostess. So ask me why, I don't know. Because I wanted to travel. Then when I grew up, I changed careers so many times. So it's lovely to see that you've always wanted, and just the passion
Yeah.
that you have. So you talked about being an artist and
Yeah.
changing the center. What is the artistry of, like, when you say art, what do you mean exactly?
So it's one of those things where there is a science to plastic surgery, right? Where you are a surgeon. So when you go to school, they teach you how to be a surgeon, but they teach you also a way of thinking, because what we do as plastic surgeons is we move around tissue. So we kind of move around like flesh in a way that is supposed to improve either someone who doesn't look normal, or to make someone look better than they used to, and things of that sort. So that's that kind of keen eye that you have to develop in order to actually become a plastic surgeon. I remember looking at my bosses, like my first years in training. And then they would be like, oh, okay, so they'll remove that cancer there. And then what we'll do is we'll take that skin and move it there, and then like shift this one to there. And I would be like, how do you get your brain to start thinking that way? And then one day I woke up and I was thinking that, and I was like, oh my gosh, this is so cool. So till today, I really think my job is super cool. I'm like, I geek out every time I wake up and get to do my job. So.
Wow, I love that. Well, I love that about you. You know, like, just the passion shines through. So where did you study, and what are some of your difficult moments as a plastic surgeon?
Okay, so I studied, so you just have to start with general medicine. So you have to start with undergrad of medicine, and I did my medicine in Malawi because my mom is actually Malawian, and I did my high school and my undergrad in Malawi. And then after that, I moved here to Zim. I did my internship here at Parenyatwa. And that's when I started. There was one plastic surgeon who was on the ground at that time. And then because I had done my research, and I had like tried to find out like where I can get guidance and all that. I remember he even laughs till now that it was only a couple of years ago you were sitting in my office, and I was like, who is this lady? Because I kind of like walked into, I'd never like talked to him before, and I walked into his office and I was like, Prof, I hear you are the person to talk to about plastic surgery, and I've made up my mind that I want to do plastic surgery. How do I go about it? So my questions were, do I do it in Zim? Do I do it elsewhere? How can I start my career? And then he pointed me out to a program that's through the College of Surgeons of Eastern, Central, and Southern Africa. So basically what you are, you're a Zimbabwean candidate, and you do part of your training in Zimbabwe, but there's certain things you can't fully train a plastic surgeon in Zimbabwe because there are different aspects of it that you don't get to see in Zimbabwe. So there are a lot of organizations that then send you out for certain aspects of your training. So that's how I got my training from plastic surgery. So I ended up having to go to places like Ethiopia. I've gone to Kenya, Rwanda, Uganda, and also the United States.
Wow.
Yeah.
Okay. Wow. So now let's get into the meaty questions. So one of the first questions that I got from a lot of people is, how safe? I mean, we've heard stories.
Yeah.
Plastic surgery. We know people. I mean, I know a person who died after having a BBL. So how safe is it, to have plastic surgery?
So yes, weirdly enough, that's the first question I get from most people, and they're like, "Why are people dying from plastic surgery? Why do you continue to practice plastic surgery if so many people are dying from plastic surgery?" So the thing about plastic surgery is it's like all surgery, right? Surgery has its risks, but we make sure that we don't want you to incur those particular risks that end up having you lose a life. So in plastic surgery, you're basically working on a person who is healthy. Ideally, you're not someone who's sick when you walk into the door. You're a very healthy person, and therefore you should walk out a healthy person. So the thing is, we make it very safe because we want to make sure that you go through it you walk out the same way you walk.
Let me
back
cut
in.
you there quickly. you said safe. You said healthy. So when you're saying healthy, what do you mean? Do you test them? What, like?
Yes. So I was about to get into that, where we do a pre-op evaluation. So I will sit you down. So a lot of people always like, when they text my secretary or they text me directly, they're just like, I want a BBL. So give me a price. And I was like, unfortunately, it's not like buying tomatoes at a supermarket. Yes, if one tomato is 10 cents, one tomato is 10 cents. But in terms of for us, first of all, I want to see if you're a right candidate for a BBL. And the other thing is, one BBL is not the same as the second BBL. So you need to go through a patient evaluation. So I generally don't say, okay, so I'll be like, yes, you're suggesting that you want a BBL. Let's look at you first. Let's take a history. Tell me, do you have diabetes? Do you have any other issues? Have you had surgery before? When you had surgery, what then happened? Things of that sort. So we do an evaluation to make sure that we can go through things safely. And if you have any other things, are you still able to go through this particular surgery safely? And then if you aren't, we tell you that, you know what, these things must be done first. And we'll do some tests right before the surgery. We'll do tests that give us a go ahead to be like, okay, this person can go through. So we're not, and I love how people think that somehow the medicine stops and when you get to plastic surgery, it's no longer medicine anymore. So it's just now people are just doing all crazy sorts of things. We're still doctors. So we still do the proper evaluation. We'll examine you. We'll do the tests that we need to, so that we make sure that everything goes through safely. And sometimes there are people where I've said, at this point, we cannot go ahead with your surgery because of this, or you need to be evaluated by your physician to make sure that your blood pressure is under control and things of that sort. So that's the thing. So you have to go through a proper evaluation in order to make sure that you're safe in order to go for surgery to begin with. Before we can then say, okay, let's go ahead with the plastic surgery. So that's why I say it's a safe procedure, because we go through all those pluses, all those ticks to make sure that you're healthy enough for the procedure. And what happens is there's a lot of bad stories out there in social media. But when you go down into the history, you find that these things are being done by dentists, people who are not qualified to perform these procedures. Or
a dentist doing it.
I've heard of dentists in what you call this in South America. Dentists are doing liposuction. And it looks like an easy thing to do because everyone just thinks, it's not really medicine, but it really is, unfortunately. So you have to go to a proper professional. If you go to a proper professional who has been trained in doing this, they should do all the evaluations, tick all the boxes, and make sure that this procedure is gone through safely. And if your doctor says you're not ready for the surgery, don't then go to someone else who'll tell you, yeah, let's go ahead. Let's do it. So yes, so a proper doctor should be able to tell you, okay, I need to look at this, just to make sure that you're safe in order to go through the procedure.
Wow. So what are the different types of plastic surgeries? Is that what they're called? Like, because the only things I can think of, obviously, things to do with women, BBL, tummy tuck, whatever, all those things. What other reconstructive surgery?
Yes.
That's what it's called. That's the word.
So they're different, like, arms of plastic surgery, right? One arm is the cosmetic surgery. The other arm is reconstructive surgery. So with reconstructive surgery, what we're basically doing is it's medically necessary procedures. So these are done when someone has gone through an accident, someone has had burns, someone has been born with a deformity that needs to be fixed. So medically necessary things. Whereas in cosmetic surgery, we're just enhancing. You're okay. You're fine, but we want to enhance how you look and make you feel better about yourself and just make you a slight improvement. So it's not medically necessary, but it is an enhancement of sorts. Yeah.
Okay. So what is covered by medical aid between the two?
So reconstructive surgery is covered by medical aid. Unfortunately, medical aid will not cover non-medically necessary procedures.
Oh, okay.
Yes.
All right. Okay, let's go to cosmetic surgery.
The exciting part.
The exciting part. When you look at your work history, the youngest person you ever did cosmetic surgery on?
So the youngest, I think, so there's a blurry line there is a part where the cosmetic surgery and the reconstructive surgery do meet. I have done relatively younger patients who are like mid-20s, but these are patients who have like very large breasts.
I was actually going down my next question.
Yes.
Oh my God.
So breast reduction is one of those things where some people might consider a cosmetic surgery, but For a 23-year-old who can't go to do sports anymore, is it still really cosmetic surgery or this is medically necessary? So now that's where the line gets blurred. So I have done things like that where I've done like breast reductions or even just very droopy, like weirdly droopy breasts in a young person, and they're like, I just can't shower at boarding school anymore and things of that sort. So yes, I've done patients in their 20s before.
I actually want to go to breast because for me it's a big thing because I have like my niece was actually operated but overseas.
Okay.
So now, but hers was covered by medical aid because her her breasts were really big and it was affecting her sports and things like that. Mm-hmm. How safe is it for a person who hasn't had children? Mm-hmm. So in terms of breastfeeding and things like that, to have a breast reduction because you find that it does affect them, sports, back and things like that. One, in Zim, does medical aid cover? And two, what actually goes on with it and the healing process? And then later on, when it comes to breastfeeding and things like that.
Okay. So in Zimbabwe, some medical aids do cover depending on what scheme you're on and what medical aid you're on. And sometimes they cover part of it, say they cover to a certain extent. But what I've seen is with the medical aids, they want a history of you having had the back pain and all that. There must be like a trend of you making that breast reduction necessary. So depending on your medical aid and depending on the history that you have, and they even want like measurements and some even want pictures so that, it's crazy. So that they deem the breast reduction necessary. But yes, they do. I know CMAS covers, Alliance does cover. So they do cover, but they really want a lot of background work behind to just make sure that it's not you just wanting a breast lift.
Breast reduction.
Yeah.
Okay.
Then in terms of, obviously a breast reduction in a patient that is young, that is still yet to have children or is not even sure whether they want to have children and all that is not taken lightly. So it's one of those things where we have to sit down and really discuss. So depending on what kind of breast reduction you get done, how much breast tissue you have removed, it means that there is a chance that you might not be able to breastfeed. And this is a conversation we have to have frankly. And the person has to truly understand that either the breast, because we're taking out a lot of breast tissue, right? So that means that either the person might not be able to breastfeed at all, they might have reduced breast milk production, or there might be no change at all. But we always have to talk about the fact that are you prepared to to bottle feed when you do have your children? Back in the day, depending on the techniques that we used to use, there was also issues of nipple sensation, alteration of nipple sensation. But with the current techniques that we use, it's not really a problem anymore. There might be a little weirdness just after the surgery, but then in a month you're back to normal. So that's one of those conversations that we do have with my patients. So it's one of those things with every surgery. You have to make sure that the person, number one, understands what is actually what is the surgery, what is going to be done, right? And how are you going to be changed as a person? What possible complications are there, and how your life is going to change after that. So with breast reduction, it's a lot of like conversation about that, and the breastfeeding thing is a big thing that we need to discuss. But so a lot of people sometimes people even say, I'm not ready. I'm not ready to make the decision of whether I cannot breastfeed my child or not. Or some people are saying, you know what, I am okay. There's no really, I really don't feel there's a problem with bottle feeding. So it's just we make the patient aware. We don't make the decision for them, and then they make the decision based on the information we've given them. I usually say a consultation is not for you to come and then be like, let me go for the surgery. It's to give you the information to evaluate you, and also give you enough information to be able to make a decision on whether you want to go for the surgery or not. And it's allowed to be like, you know what, maybe this is not the surgery for me. Yeah.
And the healing process, how long does it? So let's say you're, for example, you're 36G or H, whatever, and you want to be a 36B or D cup.
Okay. All right. So yeah, sizing is one of the things that we talk about in the consultation as well. Some people want to get ridiculously small, and I'll be like, no, we can't go that small with your body frame and all that. So yeah, so the size is something we also talk about in the consultation. In terms of your healing time, breast reduction, weirdly enough, is actually people heal very quickly and very nicely. So it usually takes around 2 to 3 weeks, you're fine. But I always say to tell my patients to give it a month. and then they should be ready to basically go back to normal activity. Yeah.
And what if it's an old person who wants a breast reduction and it lifted them up?
That is perfectly fine. How old is the question now, right?
Mid-50s, someone going through like their...
Honestly, if you are healthy enough, I have no reason. If there's no other health risks that are involved, I have no problem with doing a what you call a breast lift or a breast reduction on a patient. It's all about, for me, it's not about the age. For me, it's about how healthy you are for surgery, and the reasons behind it as well. Because some people will be like, I want to look like Kim Kardashian, and I was like, maybe I can't make you look like Kim Kardashian. So most people, I'm always like, maybe go somewhere else.
So people actually come and say, I want to look like you.
People say a lot of strange things. And people can be difficult. So sometimes you want to pick out that person who's going to give you problems way at the beginning, and you're like, maybe no, let's not do this. So yeah, so for me, I'm not speaking for every surgeon, but for me, I always want to listen to someone's story and always think, is this necessary? Because yes, people will always be like, breast lift is not necessary, but I always think there is a reason, right? If I had droopy boobs or big boobs, I would want them reduced, but the story is always different. You always find someone who is not factual, who wants things that are out of this world. Then you have to walk away from exactly. So you have to walk away from those people very quickly. But people who want things that are within reason, then I am very happy with doing those cases. Yeah.
So for any plastic surgery, do your patients go through counseling or any sort of therapy?
So I don't routinely do counseling, but I do for certain. I do it on a case by case basis. It's like, if I feel, as I said, if a person comes to me after having 5 kids and wants a tummy tuck, and obviously their tummy is droopy and whatever, I don't think that's a ridiculous request, right? So I am happy with doing a tummy tuck on a person like that, because their request is very logical, and there's no signs or red flags about mental issues. But again, we do talk about everything about it, and if I do have things like red flag signs, I do then direct them to a psychiatrist. But then there's certain conditions that you'll be like, before I touch you, maybe go through a psychiatrist. So I do it on a case. I don't routinely send all my patients to a psychiatrist. Yeah.
Okay.
Yeah.
So let's go to tummy tuck actually. What are when we look like on YouTube and TikTok is the worst, eh? TikTok, yes, everything is the worst. And I see those tummy tucks and the cutting and the whatever. How long does it take to heal? Let's say if you have a tummy tuck or what's the difference between a tummy tuck and liposuction, or is it the same? And also, what does it entail? And also, obviously, again, the healing process and the kind of tissue, whatever fat that is removed,
Okay. So yes, a tummy tuck and a liposuction are two different things. So with liposuction, we're just removing the fat, right? The accumulated fat right under your skin. So we just basically make small holes and we suck out the fat from under your skin. But with the tummy tuck, what we're doing is we're cutting out the skin, the excess skin. So tummy tuck is ideal for those people who also have like that hanging skin.
And those that have lost. What about someone who's lost a lot of weight?
Even though those that have lost weight as well. If you have a lot of like excess skin, that has to be taken care of by cutting off the skin. So if we're cutting off excess skin, it's now a tummy tuck, as opposed to just liposuction is just sucking out fat. So obviously liposuction is a smaller procedure compared to a tummy tuck. A tummy tuck is generally a bigger procedure because more is.
But liposuction is more.
Really, because liposuction is just sucking out fat. You look battered and bruised, but like the scars are less. The healing time is a lot less. Liposuction now takes to about 2 weeks. For full results, you're looking at 6 weeks. But for you to go back to your normal routine, I would say in 2 weeks you're fine, and then to then see all the maximum results of your surgery, you're looking at 6 weeks. Whereas a tummy tuck, so what we do in a tummy tuck is, first of all, I do what's called a lipo-abdominoplasty, which combines liposuction and tummy tuck. So we tuck the lower bit of your tummy, but we also liposuction your sides. And then in a tummy tuck, what we do is women who, because a lot of women who undergo tummy tuck are women who've had quite a number of pregnancies. So we do what we call a muscle repair, because you find that with pregnancy, those muscles that make up the 6-pack, kind of like they stretch out to make up for the pregnancy, and then they shrink back, but they never quite come back together, right? So you'll find that there are lots of women, even some who are even skinny, but they still have that little bulge in their stomach. It's because their muscles are generally separated because of the multiple pregnancies. So in a tummy tuck, we actually lift off all the skin, we put those muscles back together. We pull everything down, we cut out all the excess skin, and then we liposuction the sides. So it's a more invasive procedure.
Oh.
There's a lot more being done.
How many hours is that?
And people always want to know how many hours, but like,
Yeah.
oh, you're sleeping.
That was right.
It's mine. But anyways, it's up to about 4 hours. Sometimes when it's quite extensive, we can go up to 6 hours. I've done 6 hours before.
Oh my.
Yeah.
Oh my word.
Yeah.
And then, so recovery is what, 6 to what?
So with recovery for tummy tuck now, for tummy tuck, I tell people for about 6 weeks. 6 weeks you should be, but you can. People return to work after about a month.
Really?
Especially if you have an office job. What you do is there's no manual activity involved. In a month, you should be able to go back.
And exercise?
Exercise, I tell my patients they need to give me 6 weeks to 2 months, but I always say we talk about it.
Okay.
We see how you're recovering, and then I will say, okay, you're ready to go back to the gym now.
Okay.
Yeah.
Do you ever combine like a tummy tuck and a bum, what you call lifting bums or whatever, or
the
BBL or
whatever.
BBL or whatever?
So-
would you ever combine the two together? Oh, have you done that before?
So there's a set of procedures that I do combine, certain ones that I don't combine. So I don't combine a tummy tuck and a BBL because they're two sides, right? So two sides. So you can't then sleep. The patient has a problem with where do you then rest, right? Because now you want to keep off your bum, but also you can't lie on your tummy because you're in pain. So that I think it complicates the procedure, the recovery time because of how you're going to be like recovering, in what position you're going to be recovering. So for me, a BBL and a tummy tuck, I don't do the same sitting. But the ones that I've done in combination a lot is breasts and the tummy. So I do those like routinely a lot. So that's the mummy makeover. So a mummy makeover is when you combine multiple procedures together.
Mummy makeover?
Yeah, it's actually a term in plastic surgery. So yeah, it's a mummy makeover. So it's like a combination of plastic surgery procedures that we do. So yeah, so I do a lot of breasts and tummies. I do at the same time a lot. Sometimes I'll do like a tummy and liposuction of the thighs or the arms. Yeah. So those things so it's just, for me, it's about like the positioning and also the recovery, how it is that you recover. Because in a BBL, once you have BBL is basically we take fat from somewhere else and then we inject it into your bum area. So you're not supposed to lie on your bum for a certain amount of time.
That's how long?
So for me, and every surgeon has their different a different routine. For me, I say absolutely no being on your bum for a week. That includes not sitting on it, not sleeping on it, and then after that you're not directly on it. There's a special pillow that we give you that you actually have to you'll be sitting more on your thighs. You'll be sitting on a chair, but like the pillow will be hoisting you up so that you're on your thighs and you're not putting pressure on the bum for at least for about a month.
Oh, okay.
Yes. So that's the difficult part about the BBL. It's the low pressure on the bum area that is particularly problematic.
Oh my gosh. Okay. But do you ever have issues with like clotting and things like that? Because I remember someone was saying they were thinking of having one, and then someone was like, oh, there's a problem because of if some people clot when they are after the operation.
So yes, so that's one of the complications of long surgery in general, but it was also one of the ones that has gotten a lot of like limelight in terms of the BBL. With fat injections, if you inject the fat in the wrong place, first of all, you could inject the fat into a blood vessel and then it might shoot up and then go to your heart or go to your brain, and that might cause big problems. So it's all about, number one, knowing where to inject the fat, right? So you shouldn't inject it too deep or else it'll go into the wrong place, and then yeah. So it's about knowing how to do the procedure, first of all. Then blood clots are well known for developing if someone has gone through long surgery. So you'll find that we have like multiple things that we do in order for you to stop things stop you from getting blood clots. And if you're on any particular medication, we will stop certain medication that increases the clottiness of your blood. We will we give certain medication to thin out your blood a little bit so that it's not in a we call it a hypercoagulable state where it's clottier than usual. So we want it a little like less prone to developing clots. In surgeries, we'll have like socks that kind of like squeeze your legs so that the blood doesn't clot in them, because it's usually in the legs where the blood clots. After the surgery, we'll give you injections to thin out your blood. And then I also don't, at no point in my surgeries are you bedridden, because again, lying in bed also increases the chances of you getting a blood clot. So I always tell my patients, I want you walking from if we do the surgery in the morning, by evening you should be walking. So I don't even put a tube for urine. I want you, at the very least, you shall walk to go to the toilet. So yeah, so we early mobilization, we do a lot of, we give you medication, we give you like socks, special socks and all that. So we do a lot of things to prevent that blood clot. But it is it's a known risk, but it's one that we mitigate with a lot of things.
Okay, so
yeah.
For someone who is like, I'll give myself as an example, because I got DVT once after a long flight, but luckily my I went to emergency rooms and they noticed it very quickly. And then I was in hospital if I decide to have, let's say, a tummy tuck or a mummy makeover with that history, and I've passed all the other health exams except my history.
Okay.
Is it something that would be looked at or not?
It will definitely be looked at. So that's one of the things that I was talking about. Like, we sit down and ask about that history. Have you ever been in hospital before? Have you ever had any complications before? So we'll look at that history. We'll probably do extra tests that we won't do in a person who doesn't have a history of blood clotting. We'll look at your blood again. We'll see if there's a risk of you having blood clots. We'll give you certain medication before the surgery, during the surgery, and after the surgery to make sure that you don't have those blood clots. If we do find that your blood preoperatively, we find that your blood is at risk, we treat that situation first before we go for surgery. Okay. So yeah, because it's a complication we definitely do not want.
Yeah. Okay. What when you're going through, tell me your thought process when you're in surgery. Where's your mind? Because I always look, TV tells us other things. But when you prepare for surgery, what goes through your mind? Like how, and then when the patient comes out, how do you feel?
Honestly, I am always excited for each case. Like, I'm always like super excited for, like, as I said, I'm one of the, even people who know me will be like, Tinga, excitement for your job is a little weird. And it's just like, what's wrong with you? So my first thing is that is obviously what we do in my practice is that we'll have that initial consultation. And before you go for the surgery, before we convince ourselves that, before you have said, okay, Dr. Nyoni, I've thought hard and fast about everything that you've told me, I'm ready to go for the surgery, we have another sit down. Where we sit down, we talk about the surgery again. My anesthetists also look at you, the ones that will put you to sleep. They look at you, they go through your history. They give me a go ahead that they're happy with putting you to sleep. And then on the day of the surgery, I always have this thing where in the morning I will look at your pictures again and like have mental thoughts of, because I do pre-op pictures in those. There's certain patients who will say, no, I don't want pre-op pictures, but generally I tend to have, most patients will have pre-op pictures. So I look and I'll be like, I come up with the game plan. I'll be like, okay, so this is what we're doing. Okay, cool. Then I come and see you in the ward before you go to the operating room. Then we talk about things again. We're like, okay, so this is what we're doing in the surgery. I look at you, I do a mental note of what we're doing. And then I leave you there because that's when the team comes to pick you up. Then I go straight to the surgery and have a briefing with the team that will do the surgery with. Be like, okay, so we're going to start with this. The patient is going to start on this position and blah, blah, blah. And then we get going.
Wow.
Yeah.
Okay. Wow. That's very, because you always think that it's just maybe in and out, but I just that whole thought process, I didn't realize there's quite a lot that
there is a lot of background
before and then afterwards. So when you see your patient 6 months or 3 months later, just looking, what's that how do you feel?
I am always super excited because like I find a lot of my patients all have different stories, right? And their excitement is always, it's never the same. Every patient's story is different. And the thing with these patients is you always have their background story. And there's always a reason why someone is getting that tummy tuck, or someone is like, so like a lady who once had like a breast reduction told me, for the first, she watch TV with her husband for this first time in years because she couldn't sit on the couch because her breasts were too heavy. So it's things like that. They she'll be like, so I was watching TV and I was realized this is the first time I've done it before. So it's always like really interesting to get those stories. And I'm always just like so happy and as a surgeon, obviously you have like self-critique. You're like, what did I do right here? What could I have gotten wrong? What could I have done better and all that? And we discuss and we talk with the patient, their expectations, if they're happy and all that. So that's what happens after that. Like when we're towards the end, because you have a lot of like visits after the surgery when we're doing the dressings, and after that when we're just seeing everything is healing well. Towards the end, the last what you call this visits are always very interesting because then the person has seen the results of their surgery. You have also seen the results of what you have done, and then now we can discuss and be like, okay, so are you happy? What would you do? What would you do different? Blah blah blah. And you also as a surgeon, surgeons are very critical of themselves. So you look at and you're like, am I happy with my work? Even if the patient is happy, am I happy? So that kind of thing, yeah.
Oh, okay. So what are the 5 biggest life lessons from a patient's point of view, what you've learned from your patients to say, these are the 5 biggest life lessons I've learned from the patients. And then what are the 5 biggest life lessons that you've learned as a person from all this experience?
That's a very difficult question. Okay. Let me see. From my patients, what I have learned is that, first of all, it's as a patient, you kind of have to be vulnerable in order to allow your surgeon to be able to do what they're doing. So yes, we'll discuss what the surgery is going to be. I'll explain as much as I can, but there's a certain vulnerability to becoming a patient where you now have to leave everything in my hands and be like, and trust the process that Dr. Nyoni understood what I want, and she will carry on. I'll be asleep, and Dr. Nyoni will carry on my what you call this, my expectations. So that's and I've learned that it is not an easy thing to do, and that's why a lot of patients are very skeptical of doctors, and that's why a lot of this, you see a lot of things on social media where they're like, but because it comes from a place of vulnerability, where they had to be very vulnerable, and you just can't be vulnerable with anyone. So initially I'll be like, the patients are so critical. Don't they know that, like, what you call this? We're professionals, we're doing what we're doing. But now when a patient comes and says, Goody, I want to sit down again with you. I want to know your credentials. I want to know what cases you've done before. I don't treat it like something like, they're sizing me up or whatever. I do this, no. This is the person who's going to be so vulnerable. They need to make sure they've dotted their I's and crossed their T's. So it's something that is very difficult to do, especially for certain personalities. So it's one of those things that I've actually gotten to understand the more I've dealt with patients. And also I have realized that you might think people do things for a certain reason, but the reasons are always different. So it's one of those things that you have to get to the bottom of, as I told you, and realize, is this a reason that you're comfortable with doing a certain procedure for? So I've had this through different patients, different stories, and so it's always very interesting to see people's what you call this, to hear people's stories and to understand what the reason behind their procedure is. You always think, people want to get a BBL because big bums are in these days, but there's always a deeper story. Yes, big bums are in, but there's always a bigger story behind it. And I didn't give you 5, but those are the 2 that I've learned from my patients. Okay. For me, is what I've learned for myself is that, first of all, I think I've learned to be more empathetic with my job, because medical school doesn't make you empathetic. It makes you a task-oriented person and go and do what you need to do, kind of thing. But when you deal with a lot of patients where you see their emotional side and all that, because there's a lot of discussion before anyone gets these particular types of surgery done. It's unlike an appendix. You don't talk about people's emotions before you remove an appendix, but you talk about people's emotions because the reason that led them to getting that BBL, the reason that get them to getting that breast reduction. So it's one of those things where I was not innately empathetic. It's not something that was built in me, but it's something that I've developed. I'm not the most empathetic person in the world, but like I've developed that part of me. It has taught me to actually look at it without just medical eyes, but like more of a holistic type of approach to things. And I've also learned that I am human too, and I should, when I'm not sure, I should ask. when I am not comfortable with certain things, I should just say, you know what you're saying is something that I'm not comfortable with doing. How's about we don't do that? You take to someone else. And I've also realized that I'm not everything. As surgeons, you want to be the ultimate doctor. I don't know something, and it's particularly surgeons. It's not in all doctors, but in surgery, I don't know. I think it's our training where we want to be every doctor in one. But now I've realized that no, I have my niche. If someone happens to have this issue that someone is more of a specialist in, ask someone. Either ask them or send the patient to that particular person. It is not that you're a failure. It's actually more skilled to know your limits and to know how far you can go before you mess up things. So yeah. So I've become very okay with being a human.
Oh wow, that's I like that part, because I think for me for a long time when I was young, doctors were not empathetic. It's like we just coming in and you're like okay, all right. Prescription out. And I think that is so important. That part for me is very important, that being empathetic, I think, because we come in and we have our problems and it's nice to have an empathetic doctor. So I know I just have so many questions, but I know we're running out of time. We're going to need to get you back in. But there's just one more thing that I just wanted to find out. What kind of cosmetic surgeries do you do?
So I do a little bit of everything. I do breasts, either making them bigger, making them smaller, lifting them up. I do tummies, making them smaller, making them flatter. I do body contouring, just that kind of like improving your shape. I do BBLs, that's increasing your bum size. And I do liposuction in all other different areas. If you have even, sorry about that. If you have even like fat collections in different areas, I do that. I do ears. I do lips. I do most of the full spectrum of plastic surgery. What I don't do at the moment is hair transplants. That's what I don't do. Yeah.
There's such things as hair transplants?
Yes, there is. Modern medicine is doing all sorts of things.
Are you kidding me?
I am not.
Wow.
But okay. Watch this space. I will be doing it as soon.
That'll be very interesting because you're my hair. I picked my mom's hair. That's where it all starts. So just to close us off, I'm going to ask you just a few fun questions because, oh my gosh, I still have so many questions that the ladies had. There was not enough time. You know, ladies had sent me, I think a lot of ladies, it's and like what you're saying, it's not because, some of them, it's not even because that they think like lowly of themselves, but it's just like what you call mommy makeover. And I think, we've carried pregnancies, we've done all this thing, and I think we deserve those things.
Exactly. Why shouldn't you? So there's a new trend these days where, like, as a push present, as a final push present, how husbands are giving their wives a money makeover. So just to put it out there.
Oh, wow, nice. And okay, can we talk pricing, or it depends obviously with every case?
So it depends. It's very difficult to. I don't have a one price fits all type situation. So I will give you a quotation after you come for the evaluation and I see how much work needs to be done, and then we can talk pricing. Yeah.
Okay. Yeah. All right. Fantastic. Right. Just to close us off, Doc. Just a few fun questions.
Okay.
What's your favorite color and why?
So I like purple. Why? I think it's just bright and cheery, like my personality, I guess. Yeah.
Okay. And your favorite animal and why?
I like a tiger. They're fast, they're vicious, they're powerful.
Wow, I love that. And the one book that's made a huge difference in your life?
One book that's made a huge difference in my life, Eat, Pray, Love. Eat, Pray, Love was a good book. It was just one of those things where before women were thinking about taking time for themselves after something tragic happens to them. So it was one of those things that made you start thinking outside your head and be like, you know what? It's okay to take a trip for yourself and take time apart for yourself. And self-care. So that was...
Did you watch the movie?
I did watch the movie. I read the book first and then I watched the movie, but I feel like, like all times, the book is always better.
I was actually saying to someone, because I read the book first, and then when I watched the movie, it was like, okay.
But sure.
Yeah, because I think the book just had all that. And then movie, obviously. What's your favorite movie that you've watched that's made an impact in your life for some reason?
Movies are difficult because I am a TV person. Like I watch a lot of TV.
Wow.
I watch a lot of TV.
Really?
Yes, it's absolutely unhealthy. Hey, that is a difficult question. I can't think of a single movie to be honest. A series. Handmaid's Tale. That comes to mind because like the recent season. It is crazy, right?
Yeah.
That the world can think that way. But
Yeah.
when you start thinking about the world, right, and you start thinking about how people think very messed uply.
They are.
We are not far from people thinking that far off. I know it was so extreme, but the way people are, things that are happening in Syria, things that are happening all over the world, it's scary, but the human being mind is very messed up.
It is, eh?
Handmaid's Tale is when you're like, what? Why would someone think of that?
Yeah. That's true. Yeah, people do think of.
But people are messed up.
They
is
are.
what I've realized.
They are. So when you're relaxed, you've had a good op, you're at home. How do you relax?
So I watch TV. I watch a lot of TV. I watch a lot of TV. Once in a while, I'll have a glass of wine. I like my wine. I love board games. I have a weird obsession with board games. Like, if you played 30 seconds with me, you're like, is she getting paid?
Oh my gosh.
Is she getting paid? Why is she so intense?
We used to play, like, now the girls have gone and it's just my husband and I at home, but we're empty nesters. But we used to play a lot of, like, 30 seconds. Oh my gosh.
Monopoly.
And Monopoly and other Scrabble. We used to play a lot of Scrabble.
Yes.
And we used to have teams, like my daughter and I, my husband, the other one, and oh my gosh, it was just like crazy in the house.
I'm intense when it comes to board games.
Oh my gosh, so you should come and join our family during the holidays.
You should invite me.
We'll enjoy it. So let's say this is your last day on earth and you're about to transcend. What is the one thing that you'd say, you know what, I'm ready to go because I've done what?
You know what? Yes, as in someone in medicine, you have thought about death and all that before. I think I am one person who has done all they could with what they were given in the world. I've left it all on the table. Like I think with every opportunity that I've gotten, I've exhausted it. When I could help, I have helped. When I could, when I could take an opportunity to develop myself or to do better, I have. I really think I wake up every day and I do the most.
Wow. I love that. I love that.
Yeah.
I really love that. So we've packed our bags. We have our passports and we're going to the airport. Where are we flying off to?
Ooh, Brazil.
Wow. Why Brazil?
I visited like 2 South American countries and I just love it. So, Africa we're very cultural people, right? But South Americans and Central Americans are cultural in a whole different way. And I like that they're so complex. And it's not, I find their cultural side very complex and very interesting. And their food is great and they're very fun-loving people. So they're very different, but cultural in the way that reminds me of Africa.
Oh, wow. I like that. So just to close us off, what is the one thing that you'd like to say to our viewers as they go into the week?
So as I go into the week, I'm just like, hey, I know there's a lot of difficult things out there, but like just wake up and choose to be happy. A lot of people think that happiness is something that is given to you. I've always said to the people around me, you have to strive for happiness. You have to insist on happiness. So wake up and decide to be happy.
I love that. I love that. So as we're going into the week, please just wake up and decide to be happy. And Dr. Tinga, oh my gosh, I'm so excited about the future of cosmetic surgery. I'm excited for you. And it's so nice to have young people who are now involved in these kind of things. And then it just shows how things are evolving so fast, right?
Yeah.
And I can't wait for the hair.
I'm working on it. I'm on it.
I'm really going to call you. We need to have this conversation. We need to take this forward because I think there are a lot of women who have been scared and who now maybe, I hope, will feel, okay, look, let me do this for myself. Let me give myself a birthday present or let me ask my friends to give me a birthday present. Yeah. But here it is. She's told us it's safe. And for anyone who has any questions, how do they reach you?
So my office is at Borrowdale. It's opposite Trauma Center. It's Borrowdale Plastic Surgery Clinic. I have my number is 0778 4044, but I'll give you my contact.
Yes, and then we add them on at the bottom of the description for the video. So all her details will be there and you can get in touch. Those you want to give your mom's birthday presents or anything, just go ahead. And Doctor, thank you so much for your time.
Pleasure.
I thoroughly enjoyed this conversation and we need to have a part 2.
I'm happy to come whenever you will have me.
Thank you so much. So everyone, I'll see you next week. Have a fantastic week.
Bye everyone.